Yeah, thank you so much, members of the protesters. With us here are the doctors from Kiambu County who are not at work and are on strike. It means today the union is working, and the government that has been on strike for a while has been joined by the union. We are on strike because the issues that we agreed with the Kiambu County on 8th of May 2024 have not been implemented. We went to courts, and the courts ordered the county to implement those things. The court has proceeded to cite the county secretary and the management of Kiambu County for contempt. But despite all this, the county has not responded to resolve the issues that led these doctors to strike. We have these doctors of Kiambu County who have not been promoted and employed and are paid as interns, while they're posted to different hospitals as consultants. We have the doctors of Kiambu County who have salary delays for 2 months, 3 months, while they're expected to be in the hospitals. We have doctors from Kiambu counties who are not supported to offer services in the hospitals, and they're tired of supervising death in those medical facilities. The doctors do not have medical cover, and we have to resolve into contributions every month, every 2 months, or every 3 months. And that was the reason why we went on strike. We went on strike because there have been a lot of adversary transfers. That if you raise your voice and say that you ought to have drugs in the hospital, that you ought to have equipment, that you are referring patients through ambulances, then you're transferred. So we are saying that it is important that this strike is for the dignity of the doctors and the dignity of the residents of Kiambu County who ought to get good medical services. Today is day 55 of that strike, and we are not seeing an end anytime soon. We are not seeing an end because the county government has decided to be unreasonable. They have decided that they don't care anymore whether the service is there or not. So we as a union, we are saying we will continue being on strike. We are also proceeding because the court date is coming on 23rd, where the management or county leadership have been summoned in court for contempt. We expect them to be jailed, because any death that occurs in county right now as a result of strike, the county is directly responsible. We are also here to say that all the interns, the cohort of 2024 and the cohort of 2025, the 150 interns who are in Kiambu counties, we have asked the minister to withdraw them immediately. Because there's no way we would say we have intern doctors in the county when the county cannot support the services. Today, as a union, you're putting it out clearly that any healthcare that is not functional in the Kiambu County, the county government does not need it. Last year it said that the county raised over 5.8 billion. 90% of that was from the health services. So it is impossible to make doctors to raise revenue while their welfare is not looked into. We say no as a union, and we can't allow it. This is coming at a backdrop of murder cases in National Hospital, like the one we just witnessed in Kiambu National Hospital. This death of a patient whose throat was slit